Hello, my name is Dr. Suhas Pradyumna. I have done MS in oral implantology and also am fellow of International Congress of Oral Implantology. More than 10 years of experience in the field. Today the topic that we are going to discuss is sinus lifts. Whenever a patient visits dental clinic and for replacement of a missing tooth, doctor often suggests him after taking a CBCT. Along with implant, a sinus lift procedure is necessary. This CBCT, which is basically a three-dimensional simulation of the bone that is there, and it shows every millimeter of a cross section of bone available and the vital structures associated in that particular region. Accordingly, the doctor will decide if a sinus lift is required or not. So when do we do this sinus lift? Whenever a patient is losing his teeth, getting it extracted, and he has not replaced that teeth for a long time, or if he has replaced with removable options like an RPD, removable prosthesis, then over a period of time this particular bone has a tendency to gradually decrease, because bone holds itself only when it has a particular amount of force within the limits available. So when teeth are there, that forces are delivered by the tooth itself. Otherwise an implant can play the same role. When such structures are not there, there is no need of the bone to hold these structures, so the bone gradually reduces. And when the doctor sees in the CBCT that this available bone which is required for placement of the implant has been reduced, and the upper maxillary sinus which is directly present above the maxillary jaw, then when it droops down again due to lack of these forces, the available bone will reduce, and in that situations sinus lift procedure is advised. So basically sinus lift procedures are two techniques. One is called an indirect technique and one is a direct technique. Just suppose this is your maxilla, and if this teeth has been removed and the socket which is there underneath, if we are taking an approach in which we are using this hole to gain access to the membrane and lift it up so that we can generate that required height for placing the implant, this is called an indirect technique. If we are raising the gums, we are elevating the flap and we are creating a window on top of these teeth and then raising this membrane and then placing the graft, this technique is called a direct lift. So both the techniques are been there for more than 30 years and a very good high rate of success have been observed. More than 98 and close to 99.5% success rates have been observed. When we raise this membrane, we also need to substitute it with a bone graft that is either taken directly from the patient's mouth or we use bone substitutes. The grafts are placed and membrane is raised. Now we have the available height required for placing the implant. There are again two scenarios in which we can place an implant along with sinus lift. It is called either a simultaneous implant placement with lift or a delayed implant placement with lift. A simultaneous implant can be placed when we see that the available bone whichever is there is sound enough to hold the implant and we get a good primary stability. In that situations we do a simultaneous placement. But if you happen to find the bone not good enough to hold the implant, then delayed approach is advised. That is basically about the sinus lifts. Like this video, please share it, subscribe to our channel, and for more such useful topics, please go through the links, and if you wish to see this in a different language, the links are available as well. Thank you.